Hey everyone, welcome back to our channel for health promotion presentation from Dr. Alfred Egedovo, sponsored by GHC Hospital. Today we're diving into a topic that affects millions of people worldwide, alcohol use disorder or AUD. But here's the twist. Did you know that AUD isn't just a black and white issue? It actually exists along a continuum. Let's unpack that. Alcohol use disorder, AUD, is a chronic relapsing condition characterized by an individual's inability to control their alcohol intake despite negative consequences. According to the National Institute on Alcohol Abuse and Alcoholism, NIAAA, AUD affects an estimated 15 million adults in the United States. However, the prevalence and impact of AUD are not uniform across all demographic groups. So what does this continuum mean? Imagine a scale from mild to severe. On one end, you might have someone who enjoys a drink socially, and on the other, someone whose life is deeply affected by their drinking habits. But where do we draw the line? Is it the number of drinks consumed, or is it about the impact on daily life? Gender differences in AUD prevalence have been well documented, with men historically showing higher rates of alcohol misuse compared to women. However, recent studies have suggested that the gender gap may be narrowing, particularly among younger generations. Women are more likely to experience certain health risks associated with alcohol use, such as liver disease, heart damage, and breast cancer, at lower levels of consumption compared to men. Despite this, women are often underdiagnosed and undertreated for AUD due to social stigma, gender bias in healthcare settings, and differences in alcohol metabolism. Here's a thought. Could someone with a few drinks a week still be struggling with AUD? It's a controversial question. Some experts argue that even moderate drinkers can experience harmful effects, while others believe that it's all about the context and consequences of drinking. The elderly population also presents unique challenges in identifying and treating AUD. Older adults may be more likely to self-medicate with alcohol to cope with age-related stressors such as loss of loved ones, retirement, or health issues. Additionally, age-related changes in metabolism and decreased tolerance to alcohol can increase the risk of alcohol-related harm and interactions with medications. Screening for AUD in older adults may be complicated by co-occurring medical and psychiatric conditions leading to misdiagnoses and inadequate treatment. And let's talk trends. With the rise of sober, curious movements and alcohol-free alternatives, many are questioning traditional drinking norms. Are we redefining what it means to have a healthy relationship with alcohol, or are we just creating new labels? Individuals with high socioeconomic status, SES, may also face barriers to receiving appropriate care for AUD. Despite having greater access to healthcare resources, individuals with high SES may be less likely to seek treatment due to concerns about judgment or stigma from their peers. Additionally, cultural norms within affluent communities may promote heavy drinking as a form of social bonding or stress relief, further perpetuating AUD. Now here's where it gets really interesting. The DSM-5, which is the manual used by mental health professionals, lists criteria for diagnosing AUD, but critics say it can be too rigid. Shouldn't we consider individual experiences more holistically? What do you think? Diagnostic categories for AUD are based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, and can vary along a continuum from mild to severe. Research has shown that individuals with mild or moderate AUD may not present with obvious signs of impairment, making early detection challenging. Furthermore, the stigma surrounding alcohol misuse can deter individuals from seeking help, delaying intervention until the disorder has progressed to a more severe stage. As we explore this continuum, it's crucial to remember that everyone's journey with alcohol is unique. So, whether you're someone who drinks socially or someone who's seeking help, understanding where you fall on this spectrum can be a game changer. The impact of AUD on public health is profound, with alcohol-related hospital admissions, premature deaths, suicides, and fatal traffic accidents, contributing significantly to the burden of disease. According to the Centers for Disease Control and Prevention, CDC, alcohol is a factor in nearly 1/3 of all fatal motor vehicle accidents in the United States. Furthermore, individuals with AUD are at higher risk for suicide, with alcohol misuse present in approximately 1/3 of all completed suicides. In order to effectively address AUD in different demographic groups, a comprehensive approach that considers individual, social, and environmental factors is essential. Targeted interventions that address gender-specific risk factors, age-related vulnerabilities, and socioeconomic disparities can help improve early detection and access to treatment. Public health initiatives aimed at reducing alcohol-related harms, such as increasing alcohol taxes, restricting alcohol advertising, and implementing screening and brief interventions in healthcare settings, can also play a critical role in prevention efforts. In conclusion, alcohol use disorder is a multifaceted problem that affects individuals across various demographic groups. By understanding the complexities of AUD and the unique challenges faced by different populations, healthcare providers, policymakers, and communities can work together to promote early intervention, reduce stigma, and improve access to effective treatment for individuals struggling with alcohol misuse. Educating the public about the impact of alcohol-related issues and advocating for evidence-based interventions are key steps in addressing the pervasive nature of AUD and its consequences on society. So what's your take? Is alcohol use disorder a clear-cut issue, or is it more complex than we think? Leave your thoughts in the comments below, and don't forget to like and subscribe for more insightful discussions. Until next time, stay curious.